How much does a second opinion for lymphoma cost if not covered? When facing a diagnosis like non-Hodgkin lymphoma, many patients consider getting a second opinion to confirm their diagnosis and explore treatment options. A second opinion can provide peace of mind and help ensure you're making informed decisions. But if your health insurance does not cover this service, you will need to pay out of pocket. The cost can vary quite a bit depending on the provider, whether the consultation is in person or virtual, and how complex your case is. In the United States, a basic in-person second opinion with a specialist usually starts around $100. This fee covers the doctor reviewing your medical records, discussing your case with you, and providing a written summary. However, more comprehensive reviews at specialized cancer centers can cost around $500 or more. For example, some centers like UCI Health charge a flat fee of about $500 for a full review that includes diagnosis, treatment options, and potential clinical trial discussions. Keep in mind, this fee generally does not include any new tests or imaging that the doctor might recommend during the consultation. Virtual second opinion services are also widely available and can be more convenient, especially if traveling is difficult. These services tend to be slightly more expensive. For instance, Cedars-Sinai charges around $590 if you are in California, or about $790 if you are outside the state. This includes a personalized report and an optional virtual session with a lymphoma specialist. UChicago Medicine offers online second opinions starting at about $750, which covers record review, a written report, and a debrief call. Stanford Medicine charges around $975 for their online review, which includes expert analysis and a report sent to you and your local doctor. UWeb Medicine's online second opinion costs about $1,200, and Dana-Farber's service is higher at $3,000, including all review services. Several factors influence the total cost. In-person visits might be less expensive than virtual programs but could involve additional costs like travel and lodging. If your case is complex and requires reviewing extensive medical records, imaging, or pathology slides, the price may go up. The institution also matters. Academic medical centers and specialized cancer hospitals often charge more because of their expertise and thorough review process. Some programs include a written report, a phone or video consultation, and coordination with your current doctor, while others may charge extra for these services. Insurance coverage for second opinions varies. Many private insurance plans do cover them, but it is not guaranteed. Medicare Part B usually covers second opinions only when surgery is being considered. It's important to contact your insurance provider beforehand to understand what costs you might be responsible for. If you plan to pay out of pocket, ask the provider for a detailed estimate before scheduling your appointment to avoid surprises. If you are worried about the cost of a second opinion for non-Hodgkin lymphoma, start by reaching out directly to the institution to ask for a price estimate based on your specific situation. Prepare your medical records in advance to help streamline the process and potentially reduce costs. Consider both in-person and virtual options to find the most affordable and convenient choice. And don't hesitate to discuss your decision with your current oncologist, as most doctors support second opinions and may even help facilitate the process. To give you a clearer picture, here is a sample of out-of-pocket costs for lymphoma second opinions not covered by insurance. UCI Health charges about $500 for an in-person review. Cedars-Sinai offers virtual options from around $590 to $790. UChicago Medicine's online review starts at about $750. Stanford's virtual review is roughly $975. UWeb's online service costs about $1,200, and Dana-Farber's full virtual package is $3,000. Remember, these figures are estimates and actual costs can vary. Always contact the specific provider for the most accurate and current pricing. If affordability is a concern, discuss it openly with your healthcare team. They may have resources or suggestions to help. Seeking a second opinion is a valuable step in your treatment journey, providing additional insight and confidence in your decisions. Always consult with your healthcare provider to determine the best approach for your individual situation.